When I saw what was going on here, I really thought there might be some really specific brain involvement going on here. And a very dear friend of mine is Dr. Bradley Jabour. He is the world's leading neuroradiologist with more than 20 years in practice. He is an expert on the impact of drugs such as heroin on the brain. We had some evaluations done on you. Do we have your permission? Does Dr. Jabour have your permission to share that information publicly as a teaching tool?
Of course.
Dr. Jabour, could you come up? Please welcome Dr. Bradley Jabour. Good to see you. How's everything?
Good, thank you.
Okay, can you just start, first off, this image is not a generic image. This is Tyler, correct?
This is the powerful tool that MRI has created this image of his face, and we're going to create a window through that and look at his brain. You can actually recognize him, and now we're looking at the wiring mechanism in the brain. Just like a computer, there's multiple wires connecting the different servers in the brain networks. Okay. So we were able to get a good window into the brain and evaluate that wiring mechanism.
Okay.
On this image, what we're looking at is the engine of the brain, how the brain is working. And we can see on the normal brain, in a normal patient, that engine is working. Red means good functioning engine. And here on Tyler, unfortunately, in this region, we don't see much of that engine activity.
Okay, so what we're looking at here is an absence of blood and oxygen flow to this part of the brain, and this is the executive function area, correct?
Correct, yeah.
So what impact would this have on Tyler in terms of cognitive domains, behavior, emotion, all of that?
This controls your impulses, your ability to control anger, your ability to plan and set your life on a track, short-term and long-term goals. All of that is disrupted.
Tyler, what I'm wanting you to understand here is that pounding your brain with this heroin has essentially shut this area of the brain down. And you can go all the way through here. This is all of the area of the brain which is the reasoning center, essentially. And you can see it's not slightly different, it is dramatically different.
So on this image, there are multiple images through the brain slicing through. I picked one that shows one scar. It's an area of gliosis or damage to the brain, and there are many of those throughout Tyler's frontal executive area. It's like pouring acid into a computer. You're going to destroy those wires, and you're going to destroy the microprocessors and chips in that computer. And
this is not the only one. We just picked one to look at with this particular cut.
Correct.
Come back over here. Why don't you just take my chair, Dr. Jabour? This can affect planning, memory, reasoning, long-term planning. It affects all of those sort of things. It can affect motivation. Your image of pouring acid in a computer is really good. It just messes everything up. I want to show one last thing here. If we can clear here. And can we have the next image? These images here are showing what, Dr. Jabour?
So that is, the green represents what the normal brain looks like. Nice focal area in the front of the brain, and in the back there's the self-referential area where you understand who you are in the world, is that green in the back. In Tyler, you see that in the front, that activity is its hyperconnectivity represents this dysfunctional frontal executive limbic complex. So he has at least twice as much activity, maybe 3 times, And this gives us a platform to view him with time and see if his baseline here can improve as he hopefully gets into a rehab situation.
And you can see how much more of this area is working here and here. So his brain is having to work way too hard, even at a resting state, to just keep up.
Yes.
Okay, next, in 22 letters spanning 10 years, Brenda has really been after me to help Tyler. I'm going to tell her the only way to do that when we come back. Closed captioning provided by Want to get something off your chest? Sign up for the drphil.com community and weigh in on your favorite episodes and share your personal stories with other community members. Plus, get started on your own blog to share thoughts on the topics that interest you most. I'll be reading those message boards. Log on to drphil.com today. What do you think about what we've had to say so far?
I think it makes a lot of sense. I can't make any decisions. It all ties into why I'm doing what I do.
I want you to look at her and say, I know you love me, but you need to leave me alone and let me grow up.
I know you love me, but you need to leave me alone and let me grow up.
Tell her why.
Because I need to put my life together. I need to be there for my daughter.
If you're going to have a chance here, you're going to have a team. It starts with a dual diagnosis treatment program. That's why I've got T.J. Howard here from Origins. I've asked him to come here. He's the corporate director of Origins Behavioral Health Care, and they do a dual diagnosis treatment program. I've contacted Dr. Frank Lawless. He's from the P&P Center, which is psychoneuroplasticity. They specialize in just this type of brain rehabilitation. Dr. Jabour graciously agreed to do all of this very sophisticated imaging and analysis to identify what was going on here. He has graciously agreed to continue to track this situation to see if, in fact, we are turning on the areas of the brain that we need to turn on and calm the areas that need to be calmed, and approach this in a multimodal, multifaceted approach to give you a no-kidding chance to do this right one time.
Absolutely.
Is that true? That's true? Okay. And I am going to arrange some very important professional help for you to get yourself separated appropriately and properly from being so absorbed in his life, so you understand where those boundaries are. We have a plan and we will keep you posted. I want to thank all of my guests today. A special thanks to my friend here, Dr. Bradley Jabour. Special thanks to T.J. Howard and Origins, and Dr. Frank Lawless and the P&P Center. If you or someone you know is dealing or struggling with a situation like this, log on to drphil.com. You can tell me about it and you'll find a lot of resources there. Thank you. We'll see you next time. Take care. All right. Thank you so much. Thanks so much. Thanks for